Hi everyone, it is 12 on the dot, so we'll go ahead and get started. Thanks for joining us today. Our topic of the day for our Cancer Care virtual seminar is protecting your mental health while navigating cancer. My name is Annie Gebbe. I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host today. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support that they need to live with strength, determination, and hope into the future. Just a few housekeeping rules for today's presentation. It is being recorded. All microphones are on mute and will maintain the muted status during the session. If you have any questions or comments during the presentation, please use the questions menu. I will be checking that throughout the presentation, and we do have time reserved at the end to go over questions and answers. I'm happy to have Patty Koker joining us today. She's a licensed clinical social worker. I've had the pleasure of working with her myself, and I'm so happy she's here today. Thanks for your time, Patty. We really appreciate it. And we'll go ahead and pass the presentation over to you.
Hi, as Annie said, I'm Patty. I am a social worker working with radiation oncology. I work through the Samaritan Regional Cancer Center in Corvallis. It's kind of a weird presentation platform for me because I can't see who's on, so I don't know the community that's listening. So forgive me if it's too simple or too broad or maybe too specific, depending. The reason why I do the work I do is because I am passionate about protecting quality of life and helping people live as fully as possible at whatever stage of living they're in with a chronic condition such as cancer or other chronic conditions that we know can greatly impact quality of life. So another thing we'll be doing today for this presentation is Annie's doing the slides. So I'm going to say next for slides. So forgive that too, because that can be annoying. So next. So as we start thinking about cancer diagnosis experience, one of the things that comes up initially is, what do I do now? What is my response to stress just as a regular person prior to cancer diagnosis and then as a person once I receive a diagnosis? And this is why cancer programs such as the one here in Corvallis through Samaritan hires and promotes social workers, because social workers are clinically trained to help patients navigate their health experiences and their emotions surrounding that and their life that can actually be a barrier to care depending on what's happening currently in your life when you get a cancer diagnosis. For some people, a barrier to care might look like unstable housing, or maybe a lack of relationships of natural supports, or maybe a relationship that's less than supportive for navigating an illness such as cancer. So some of the things we do ask as social workers, who are your people? Who do you normally go to when things are hard? And that answer might be, I don't have anyone, or the answer might be, you know, my mom, my sister, my brother, my dad, my spouse, my partner, my adult children. Whoever that looks like, we're going to say, great, let's bring them on board too. And social workers in the cancer, through the Cancer Center, we support the entire family with permission, of course. So say Jane Smith, not a real Jane Smith, but a made up, you know, John Doe type name, is diagnosed with breast cancer. She's scared. We meet her for the first time. We're like, well, who are your people? And she's like, my dad and my spouse. And we say, do you want to bring them in for an appointment? And she says, yes. And we do. And that's the start of trying to figure out how can we best support Jane through this journey. Now, Jane may say, nope, I'm not worried about it. I don't need it. But chances are she might benefit from it. So that's just kind of an overview of what a type of support could look like when getting a cancer diagnosis and getting support from a social worker. We're going to ask you things like, What's going on with your job? Do you need support with family medical leave? Are you retired? What about your insurance? Do you need support with that? Some of these basic things that you don't think about until you're sick come up, and that's where social workers can provide some support and navigation in that. So next. This is a thermometer that you're probably all familiar with. This is the most updated version, so it might look a little bit different than the one you have filled out if you've ever filled one out or if you work in the cancer center and you see this. And what it is asking is, you'll get this at your first appointment, and then with radiation, you get it 2 more times. But it's just saying, what are your physical concerns, emotional concerns, social concerns, practical and spiritual concerns? And they're asking you, like, do you have transportation? Are you having memory issues? Are you in pain? Are you grieving the death of someone close to you or someone that's impacted you? Are you worried about food and childcare? You know, what's going on with you? Because what we know about cancer outcomes is they are directly impacted by people's barriers to care. So that problem list, those all have the potential to be a barrier to care. And we want to know. We want to know, maybe you say, well, I'm just scared. I have some fear. I have some loss of interest, right? And my distress level is about a 3. Like, I'm okay. I'm just scared because I'm navigating this. Or maybe it's, I have all these other things going on, or I'm scared and my distress is a 10. You mark a 10, you're guaranteed to get a phone call from a social worker, just so you all know. But we want to look at that. Your whole medical team wants to look at that to know how we can best support you, because maybe you came in already with some of these issues before a cancer diagnosis, and maybe these are because of your cancer diagnosis, right? Like work-related stress absolutely can happen when you get diagnosed with cancer and you have all of these appointments and maybe you're feeling sick and not at your best. So we want to know how we can support you through that. And this is just a nice visual of what you can expect when you come in, and know that it actually does get looked at. A lot of paperwork people fill out and they're like, I've answered this 100 times. I don't know why I have to bother, but this is definitely one we look at when we're thinking about people as they are, as they're coming to us. No judgment here, just, okay, what can we help with? Because we really do want to provide the services that support you to your best self through this navigation. Next. Okay, so you do the distress scale, you have your cancer diagnosis, and you have anxiety that's maybe up to here. I don't know what that looks like for each of you. This is the problem with not interactive, I would ask you. But what does anxiety feel like in your body? It's important to know one's own baseline for anxiety, because if I'm an anxious person all the time, maybe I'm at a scale of 0 to 10, I'm a 6 all the time, and now I have a cancer diagnosis, then maybe I'm a 7. So it's not much more than my normal, but if I'm normally a 0 or a 1, and now I'm a 7, that's a big difference, and I may not have coping skills around that. And so how does it feel in my body? And to really think about that and maybe even take note of it from day to day, because you're also maybe experiencing some new medications, some new treatments, and knowing what is anxiety and what is a side effect is helpful for your medical team. Knowing that, recognizing it is anxiety, and anxiety can be managed with some coping skills such as sleep, relaxation, some really being mindfully present. Because what happens, the worst anxiety, I think, for most of us is anticipatory anxiety. So that's the anxiety that comes in anticipation of something. So maybe it's a test result, maybe it's an upcoming treatment, maybe it's side effects for treatment. You know, I'm going to have chemotherapy on Monday. I'm going to have, 3 days of feeling really sick. And so now my anticipatory anxiety that maybe I've never had before is just ramping up. And it's making me want to do things like not go to treatment or not take medicine, or maybe feel like I've lost some hope. And that's what we want you to contact us for. We want to help you with that if you'll allow us. the social work team really does want to reduce those barriers to care, and anxiety can be a barrier to care because anxiety, just like depression, which we'll talk about next slide, it can lie to you. It can tell you that nothing's going to work. You know, it will tell you the worst case scenario. And so managing that anxiety can actually lessen pain response. It can increase closeness with relationships because anxiety gets in the way of all of that. And what we want is for you to be your best self while navigating cancer. It seems silly, but sometimes people say after cancer diagnosis for the first time, they were really examining, who am I? What do I want? What does quality of life look like? What does true living look like? And they sometimes find it on this journey, but anxiety will keep you from finding that. So some of those tools that we talked about, the breathing, some people really benefit from music, and that varies what kind of music works well for some. Journaling, so writing down, it can be journaling with a prompt, it can be just free writing feelings, emotions, or it can just be journaling as far as, I ate eggs for breakfast, took my medicine, you know, that kind of stuff, just keeping track and noticing. Maybe you do anxiety, if anxiety is your response, anxiety was a 3 today, or anxiety was a 5 today, and maybe you can notice some patterns and get in front of it. Obviously, for all of us, it's been a little cold outside, but we have had moments of okay weather where we could safely go out there and get some fresh air, maybe a little bit of movement, whatever we're able to do. Some emotional processing, either with a professional or with close, safe friends. So just kind of noticing. And then when you go in to meet with your provider, say, well, I do have anxiety and I notice these things are anxiety, but I'm wondering about these other things because I've been keeping track, and every time I take this, I feel some adrenaline, I feel a little shaky, and I've been thinking that was anxiety, but maybe it's not. So you talk to your provider might say, yes, that absolutely could be from that medicine, or I think it's probably anxiety. So let's keep working on this, right? Because we don't know. We don't know unless we talk about it and name it. And sometimes naming it takes it out of our body enough to where we can walk around it and look at it like a problem to solve in some ways. And that gives us a little more control. Instead of letting anxiety control us by telling us what we're going to do and not do, we can cope enough with it to control it and keep it where it needs to be, somewhere in the middle lane. We don't want it way up here causing issues, right? And some of that is also controlling some secondary losses, which can cause anxiety as well. So secondary loss from a cancer diagnosis could look like loss of financial stability, housing stability, just the loss of our, what maybe we took for granted as a healthy body prior. Those are secondary losses that can really beat us up while we're navigating a cancer diagnosis. So we want to be aware of that, maybe write that down, and process that with either one of us on the team, a professional, or a natural support person. Next. So like I talked about with anxiety, depression, so everyone has their own depression baseline. And sometimes depression symptoms warrant an actual depression diagnosis, just like anxiety. There are clinical questions and ratings and qualifications to have an actual depression or anxiety diagnosis. And some people benefit from treating that in different ways. But first, you have to know, what is this in my body? Am I depressed? Am I anxious? Are these side effects? Is it just in this moment right now because everything's chaotic? Or has this been part of my life in the past and now it's back? Or has it been a continuum of my life of having depression or anxiety? These are questions to ask yourself when navigating, so you know how to talk about it. You know how to say, you know, when I was 25, I had, I lost my mom. I had a time of depression. This is what it looked like for me. I'm wondering if this is what's happening now, right? And then just work on it. What you don't want to do is ignore it, because we don't want depression to be a barrier to care. We don't want depression to be a barrier to living. So a real quality of life. One of the big symptoms of depression is losing interest in things you once really enjoyed, or sleeping too much, sleeping not enough. These are all impactful of your overall health. Might impact your food choices or eating habits, and that's already hard during treatment. It might create an isolation from friends and those supports that depression tells you you don't need, but you actually do. You actually benefit from supportive people in your life. It might keep you from signing up to participate in a support group because depression tells you, I just don't have energy. I can't do one more thing. And that feels very real. And it could be lying to you and keeping you from supports, right? So we know that people that participate in support groups actually have a decrease in depression and anxiety and an increase in quality of life just from that support. You recognize, I'm not alone. There are other people doing this, other people experiencing this. A 3-day rule I always use. I worked in grief and loss for a long time, mostly with people who had lost spouses or partners. And while you're grieving, including grieving your health from a cancer diagnosis, I always use the 3-day rule. So the first day, be in bed. Stay in bed if you can, right? Keep your covers on, just get up to go to the bathroom. It's all you need to do first day. The second day, your feet need to be on the floor and you need to be moving somewhere in the house, right? So maybe you take a shower, maybe you go into the other room and sit in a chair instead of laying in the bed. You do those basic living things. The third day, your feet go out the door. So if your feet physically can't take you out the door, a chair takes you out the door, a walker, a friend, whatever, open a window and you get some fresh air and you change your environment a little bit, right? So we want to keep that rule and going so that we're not staying in bed or in a chair or not managing our day-to-day living, because that will change the chemicals in your body and your body will be in shutdown mode. And when it's in shutdown mode, it's hard to feel good. Your pain is going to be worse. You will isolate more. You won't take as good a care of yourself and you will feel bad and you won't know, is this, the situation or is this my disease? What does that look like? So what we want to do is give you the best chance at fully living, even while navigating cancer, even after navigating cancer, when you're in survivorship, as you're navigating what does living really look like, because cancer gives us this wonderful opportunity to prioritize. What is most important? What have I been putting off that I could do? Maybe I can't do all of it right now, but I can do pieces and I can look forward to doing it. Maybe it's reconnecting, maybe it's setting boundaries, I don't know, but it's different for all of us. And then because you're paying attention, what are these anxiety symptoms? What are these depression symptoms? What are these secondary losses? How are they impacting my life? Am I not paying my bills? Am I not getting groceries? What is this? And that gives us a better idea of when you might need a higher level of care. So for some people, that looks like medication. That might look like, and maybe you've had medication in the past, or this person has had medication in the past, and their, sibling says, you know what, Jane, when you were 20, you had this situation and you actually did really well when you were on this medication until you got through that and you improved, and then, eventually you went off of it, or some people stay on it, so maybe they need an extra dose or a change. When do you need that higher level of care for, medication to treat anxiety or depression? Not everyone does, but some people really benefit from it, short-term, long-term, mid-term. And then when is psychotherapy the right answer? And psychotherapy is just a big term for a form of counseling. So how do I find a counselor? And honestly, that's a little bit tricky these days because of the pandemic. Everyone's realizing I have stuff to work on and I want professional help. And so there's typically a waiting list, but your social work team through the Cancer Center can help you find someone, help you reach out, who takes your insurance, who's a good fit, get you on a list. And we are also trained and emotional support and emotional, you know, those brief interventions of teaching you some of these coping tools and strategies for navigating while you're waiting to see a professional therapist, if that's what's best for you. And maybe through that process, you're like, actually, I'm doing better and now I don't need it. Or maybe you're like, I can't wait to start and I should have done this years ago, not because of cancer, but because it's helping me remember who I am. Because I am a person that is experiencing cancer. I'm not cancer, I'm experiencing it. It's one piece of what I'm navigating because I have a big, full life. And right now, cancer is a piece of it. And once you're touched by cancer, whether it's through a loved one or yourself, you'll always be touched by it, but you have an opportunity to remember who you are while navigating that, because you are, we take ourselves in with us with whatever we do, and learning new skills, navigating, living to a higher level or creating some meaning can be very helpful for the rest of our living, right? You know, for navigating that cancer diagnosis and just living and creating and connecting new relationships and strengthening the ones we have. Next. Another reason to reach out to social work and to think about our mental health while navigating cancer is some things come up that can really throw us, because maybe there are topics that we would never talk to someone who's never had cancer before. Maybe it's a topic we don't even know how to start the conversation over. And some of those are end of life. Some people we don't want to talk about. We're like, I have a cancer diagnosis. It's curable. I don't need to talk about that. Or even, you know, it may or may not be curable. I don't want to talk about that. Or mom has it and I don't want to talk about it because I might jinx something, or that might seem like I'm giving up. And ideally, in this culture we live in the United States, we would do better talking about end of life throughout life, not when we get a diagnosis of some kind. Because we are all going to die. I know that sounds like doomsday, but it's actually not. If we look at dying as part of living as a spectrum, so, you know, there's birth, there's in between, and there's end of life and dying. It's all part of living. It's all part of living. So having things in place can actually be comforting, because no matter what happens, it's covered. You don't have to think about it that much anymore. You just have to think about how you're living with that. And so some of those end of life conversations that patients will bring up to the social work team are, I'm not married, but I have this partner. I want them to be able to make decisions for me. I want my house to go to them, whatever that looks like. And they want to figure out those documents, to have them in place, even if they're not going to die from this cancer, right? But they're like, oh my gosh, I just realized I'm a mortal being and I never put this stuff in place. So what does that look like? And so your social work team can help you with that for advanced care plans, estate planning, power of attorneys, for healthcare decision-making and estate planning. Deaths with dignity, all these things that come up for navigating end of life, you know, funeral arrangements. I mean, all of that sounds heavy, and yet it can lighten loads. And it can be, those things can be planned, you know, when we're 18, right? And that could be in place, and we just adjust as we go along. And then some things come when there's a risk that we could die from our disease process, and we might want a pulse that we talk to our provider about, so we can put it on our refrigerator so we don't get CPR if we're at that point. And that's also something we can navigate with you. Some of the other things that come up that are uncomfortable, and this is another bonus I'm just going to say about support groups. All of these things get talked about in support groups, everything here. And it's very freeing to hear other people say exactly what you're worrying about, or something you've never thought about, oh, yeah, true. So sexuality, intimacy changes from health changes, from surgeries, from being physically ill. All of these things can be hard to talk about, especially if you don't have close friends or relationships, but your team, your medical team and your social work team, we're comfortable talking about all the things. So please reach out if ever you want to talk. You want to talk about with your, maybe you want to bring your partner in and talk about these changes, saying, you know, since I've had cancer, I had the surgery and now these treatments, you know, intimacy feels different to me. My body feels different to me. And we actually are, social workers are trained clinical providers. We have strategies and tools that we can teach you for navigating that. Physical, emotional insecurities about, okay, I navigated cancer, I'm done with that. I stopped working during that period of time, but now I'm ready to go back to work. How do I navigate that? How do I say, apply for jobs and say, well, I took this time off because I had cancer, and do I say it? Do I not say it? How do I feel? What has that done to my confidence? Maybe the treatments have changed my looks, weight gain, weight loss, just different body shape, whatever that is. How do I get back to a place of confidence? And that 100% includes navigating any anxiety and depression symptoms. So just again, we are comfortable with all of these topics. The support groups are also comfortable with all of these topics, and we want to help. So call us, come into the Cancer Resource Center. They will navigate you to us as needed. They have other strategies to help as well, and supports. And really, this can be a time of reestablishing who we are in this world, knowing that our time is limited, because it truly is limited for all of us from the day we're born. But we don't always live that way until we have a reason. Maybe we've lost someone, or maybe we get sick. And living that full life matters, and making meaning out of that living that we can do really matters. And we are able to show that to others in our communities, in our families, in our friendship circles, to other support group members, to the medical team. I can't tell you how many times I've worked with someone and thought, oh my gosh, that person's journey, they are navigating this so beautifully. Like, doesn't mean they're not in pain. It doesn't mean they're not having the physical changes, but they're navigating it so openly and vulnerably and beautifully that that changes me. Like, I feel like that makes me live different and live more fully. And I think that's what we all want. I mean, that's some of the meaning. And it's like, there's no fairness in a cancer diagnosis. Nobody deserves it. Nobody deserves it. If only people who deserved it got it, I mean, what would that look like? And who would determine who deserved it? There's no fairness. And sometimes that grief and loss over our health that happens initially, especially, or as we go through cancer treatment, it can be the woulda, coulda, shouldas. I wish I would have not drank soda pop. I wish I would have, you know, the woulda, coulda, shouldas can get us. But the reality is we can't go back. We can only go forward, and we trust our team to help us through this. And what do I want my life to look like? What do I want this to look like? There's no fairness here. It's nothing I did to deserve it. And how am I going to navigate this? What do I look like now? What do I feel like now? How can I be my best self as it is now? Living maybe with pain, living with a changed set of desires, living with a changed belief, losing that idea that we're immortal, because we're not, can take some navigating. So this next slide is just some really basic tips. So some of these you all may be very familiar with. I'm just going to do, I won't do the full progressive relaxation because it is so lengthy, but the other ones I can give just a brief showing of, if you'll bear with me, and this virtual me talking to myself feeling stage, because you all are quiet on there. So one of the techniques, one of many, in your social work team, probably with all four of us, I don't know, we could probably count up 1,000 techniques. I don't know, a lot. We have many, many, many. And what I say often is you might try it. Like maybe you'll try it with me right now when we get ready to do these, and you might go, that was awkward or silly. And it will be awkward for me because I'm only seeing myself and not anyone else. But that was awkward or that felt weird. But I encourage you to try it at least twice at 2 different times, just to give yourself some muscle memory of what it feels like. So that way, if you are desperate enough to try it again, you have it in your toolbox to try when in need. And the other risk is that you might just benefit from it. So it's possible that you do it and you feel awkward and you feel silly, but afterwards you're like, that was weird and I feel a little bit better. And then the more you practice, you'll find that you can get to that feeling a little bit better state faster, if that makes sense. So the muscle memory is there, can go into that soft, relaxed breath a little bit faster, and it feels worth it, right? That's what we all want. We don't want to do stuff that doesn't feel worth it. So it kind of creates that, that belief system in our body that, okay, we recognize this, that this actually helps. So the first one's very, very simple. It's a box breath because it's based on 4. So imagine a box has 4 sides, because it does. So we're gonna, for a box breath, you breathe in for 4, you actually hold it for 4, you breathe out for 4, and you hold the out breath for 4. So if you're someone who gets lightheaded easily, maybe be gentle with yourself trying this. It maybe won't be helpful. A box breath is really great in a time of an immediate stressor. So say you're in line at the grocery store and the person in front of you is being obnoxious to the clerk and you're trying not to also lose it. So a box breath is perfect. Or if you're someone who teeters on an anxiety attack or a panic attack, prior to that, you can do some box breath or in your car as you're getting to go, if you're getting yourself ready to go into an appointment that you're really nervous about. Box breath is fast. You can actually do it with your eyes open if you want to, and nobody even has to know you're doing it, but only do it if it works for your body. So if you struggle with breath or your breathing is really shallow, you might get lightheaded. So do it in a seated position, always. And when you're seated, you can, don't always, but practice in a seated position. And if it works well for your body, you can do it while standing. But when you're seated, you have to trust that whatever you're sitting on is going to hold the weight of your body. That is key. So there has to be some trust there. And you have to, if you can, allow your bottom half to be very heavy in that seat. Just trust that chair can hold you. You don't need to hold up all your pieces right now. Let that chair really hold you. And you're going to soften your belly. So if you can imagine all these years of our life, everyone's like, suck it in, suck it in. We're not sucking it in, we're softening. You don't have to push it out, but you're having your belly very, very soft. So it's relaxed and your bottom's heavy in your chair. And this chair is holding you up. It might, even if it's not comfortable, it's still holding you up. Ideally, it is comfortable. So with that, the key to a box breath, the benefit, one of the benefits, is that you're counting. And counting can get you out of your head. So if you're perseverating on, I don't want that needle stick at the lab, say, and you're in your car and you're like, oh my gosh, I'm just gonna leave, right? Try it first, try the box breath first, and give yourself an opportunity to get yourself in a more present state. So counting gets you out of the thinking in words because you have to count. And then I like to use fingers if you can to do the 4. Because that's another part of counting that gets you out of your head and it has some touch involved. And so you can have your eyes open or closed, and I invite you to do it with me. I can't tell because I can't see you. So your belly is soft, and we're going to breathe in our nose for 4. That's 1. Hold for 4. That's 2. Out our mouths for 4, kind of noisy. That was 3. Hold that out breath for 4. And then relax. And now, blow that out into your natural breath. You might find that they gave you a little energy, might have made you a little lightheaded. If it did, notice, and maybe do it differently. Maybe extend to 6s, or don't hold your breath as long. So you could do a 4, a 2, a 4, and a 2. And just notice, right? So remember to soften that belly. And then the next one goes into that. So it's a segue into the soft belly breath. So a soft belly breath can look different for many things, but it's really the start. So again, we're heavy in our seat. Our belly is soft and we're not using it to hold anything straight. We're not slumped. We're just naturally soft and heavy in our seat. And we're just gonna let our breath kind of expand. So if you haven't done a soft belly breath before, I don't know if you see I have a scarf on. You could put a hand on your chest and a hand on your soft belly. And when you breathe in through your nose, ideally you feel your belly expand first, and then your chest expand last. And you hold it for a moment and you breathe out your mouth. So you're gonna breathe in through your nose. It's gonna go belly, chest. Hold for just a moment, and then you're going to breathe out kind of noisy through your mouth. So we're going to breathe in for 6, hold it for just a moment, and out our mouths for 8. And then relax. And with that, you should notice, am I still holding my forehead tight? Is my jaw still clenched? And one way to relax your jaw is to, some people touch their tongue to the roof of their mouth. Like that, you can't see it, but I'm doing it. And some people actually drop their tongue to the bottom of their mouth. And always have just a little bit of an opening, like your teeth aren't together. And if you can, just a small smirk or smile, and that will help further relax that face as you do that breath. And then the next one I have listed is progressive relaxation. And that actually takes like 20 minutes. And if anyone wants to, when they send in if they send in their email or something, I can send you a script, or you can come to one of our support groups. And I know I do it in mine. I'm sure my cohort does it in theirs as well. But it segues into that soft belly breath, segues us into tapping and self-massage. So I'm just going to do a couple things to demonstrate, because I see that I'm talking a lot. So tapping is wonderful for several things. And I have a script if anyone wants that, or you can join one of the support groups and do it in the support group. But it's a rhythm. So there's a sequence to the tapping. We're not going to do it all today because we don't have time, but there's a sequence to it. So just know that's one of the beauties. So there's a sequence. So it's kind of like counting that you do sequentially. And there's touching and some physicality involved. So it keeps you very present. So when you're having a hard time staying present, just take a moment and you can just do 1 or 2 sequences of tapping. This is especially good if you're anticipating results or an appointment or a conversation with a family member, or if you just need to relax to get ready for your day or for sleep or for a transition. So tapping hits a lot of the meridians, but one of the things that people seem to enjoy, not just the sequential rhythm, because if you can imagine, I have my glasses on, but you would be tapping here, and then you're tapping here, and then here, and you just go down. And as you're doing this, you can have an intention, you can have a relaxation, and your collarbones are right here. If you have a port in, you don't want to press where your port is, so you would just do one side or the other. But the collarbone is also a really nice place to provide self-massage or a pressure point. And you know you're in the right place because it's where that bone is of your collarbone and just that little dip below. And you'd press your fingers in there just enough to feel it, where you're like, oh, that's the right spot. That's the right spot. So that is where we tap when we do tapping. That's also where we press when we do pressure points for relaxation and stress reduction. And it's where one of the spots where we would perform some self-massage. Now, again, if you have a port there, don't do that side. Leave that alone. That gets messed with enough. You're not going to be doing that. But it's a wonderful way to stay present, to relax your body, and to create a sense of health and centeredness, especially when, overwhelmed, right? Because this whole navigating healthcare is overwhelming. You are not alone in that. That's 100% true. It is overwhelming. And so anything you can do to keep your body as present as possible will help. Another area for self-massage that people benefit from is right near the jaw area, just very gently with 2 fingers on each. And then on the forehead above. So if you start here in the middle between your eyebrows and press and kind of pull the skin a little bit, but right here above your eyebrows, that will give you a release intention. And these are also, if you have time to do a little bit of self-massage prior to a relaxation exercise or breathing, it can be very helpful. And then the back of the neck and the base of the head. Only if you don't have recent surgeries or, you know, some disease process in these areas. But they're all things to try or think about. And these are things we do in support groups too. And then the next one that I put on the list was the ABC breath. And this sounds funny, and it's actually hard to demonstrate because it is kind of silly sounding, but this is really great for people who experience panic attacks or anxiety attacks. And they feel themselves like when you're getting to here with your anxiety and your breath is getting very shallow and you're starting to go, oh my gosh, I'm losing it. You know 100% you need to do something, right? Sit or lay down, that's always first. So you don't want to fall down. And consider doing an ABC breath. So ABC breath is similar to counting, tapping, touching, where it gets out of the head of worries and into your head of your ABCs. And it's really hard to do ABCs without doing them in order, at least for me, but I think that's true for a lot of us. And so you're doing your ABCs and you're breathing. So an ABC breath, just for a quick demonstration, that will look silly, but you should try it if you can. I can't hear you or see you, so you're safe in the awkwardness. But you take a breath in through your nose. And then when you blow out, you're going to say the letter. So, hey, right? And then you relax into your natural breath, and then you breathe in through your nose. Be, right? And you have to do it in order. And there's a lot of letters there, right? So you're laying down ideally, or you're sitting, and you do it slow enough to where you don't get lightheaded. And then you relax in between into your natural breath. So you maybe only need to get to the letter F, I don't know, or maybe C. Or maybe you get all the way to Z and you start over again. Whatever you need to do to get out of your head and relax and soften that belly in your body so that it can be its best self. Because we want people present in this moment, not really perseverating or overthinking about what's happened in the past or what can happen in the future. Really, we want to try to be present right now so we can get the information we need, so we can give our best body to the treatments we're receiving. And we know a reduction of stress and anxiety in our bodies actually create a healthier body. So our outcomes improve and we feel better. We just do it. Reduces pain. It creates a more hopeful outlook. All of these things are protective, resilient factors when navigating anything, including cancer. And then the final one is super odd, but I don't know if you guys remember the game, probably not. Maybe if you're my age or older, Heads Up, 7-Up. But it was a game where you put your head down on your desk, right? And then you put your thumb up, right? But for this, we're really just doing I Dream a Genie arms, and our forehead is on that like a cushion, but we're either down on a tall bed, like sitting and then down, or on our desk. So this is really great for people who are working people and need a moment. So I'm not going to do it because then you won't be able to see me, but you put your head down on your desk and you do that soft belly breath while your head is ideally slightly lower. So slightly lower down, like so. And you all have seen that, like, oh, have an anxiety attack, put your head between your knees or whatever. I don't say put your head between your knees, but definitely creating a cushion with your arms, like I Dream a Genie arms or Heads Up 7-Up arms, forehead on top of that, and at a slight angle, like if you have a tall bed and you can sit near it and do that, or if you're physically capable of standing and doing that, you don't even have to do an actual breathing technique. Just that position and that change of blood flow will actually help you be more present. And if you do that for a few minutes of relaxation prior to going to bed, you may find that it helps you sleep a little bit. So those are the ones I brought for today's topic. Like I said, our team, I have many, many more that we do, including that progressive muscle relaxation, which can be wonderful for a body that's super tense with tension and stress and the worry of the world and the worry of next results, next whatever. Oops, sorry, my watch is talking to me. So it's just, these are some helpful tips you'll get more of the more time you spend with us, letting us support you, or just by email if you'd rather, or just by a phone call if you'd rather, whatever is most comfortable. And that includes to staff, to patients, to loved ones. We see our entire community as supporting our cancer program and our cancer patients. So next. Okay, and with that said, don't try to remember it all. Just remember who to call. So that's us. That's the Cancer Resource Center. That's your front desk at your medical oncology office, radiation oncology, probably the information system at the hospital will also get you to us. Any one of us. Information can and is overwhelming. Let us help break it down. Let us help repeat it. Tell us what you need. You'll pick up 10%, and we'll just keep giving you another 10%, right? Don't get frustrated to the point where you go silent. If you can help it, keep yourself present. Write it down so you take it into your next appointment or with your phone call or sending a note in my chart, whatever that looks like. Let your team support you. Let your community support you. So if you don't have an oncology team, maybe you're touched by cancer, but you don't have cancer. Maybe you're a long-term survivor of cancer and you no longer have that team. The rest of our supportive services are still available to you. Our support groups are still available to you. Let us support you, whatever that looks like. It might just be a one-off. Remember, can you show me again how to do whatever breath? Happy to do it. So, and the last tip with all that, write it down if you can. Have someone else write it down or bring someone else with you to your appointment to remember things for you and help organize and navigate for you. If you don't have someone else, let the social work team know, and we will likely be able to be your someone else, at least for that initial gathering of necessary information. So let us help you be your best selves and maybe better than you've ever been. That also happens. We always think worst case scenarios for diagnoses like cancer, but the reality is some people get through that process as being this more deepened, meaningful person. And some get out of there going, oh my gosh, I just survived this, right? And now I'm going to do all the things. And there's just a whole spectrum of responses. So try not to overthink the worst case scenarios. Instead, I say be prepared for anything, but really put out there the energy for what you're hoping for, what your best self can look like in this moment, because all we really have is this moment. No matter, we can't go back, we can't go forward to any real extent of knowing, but we do know what's here right now. And so use some of those techniques to be present, to be here, to protect your mental health. So if you don't swing into the point of having a hard time getting out of it, reach out before then, protect it now, prevent that chemical response to stress, and let us help you. And that's the end of my part. On to you, Annie, for questions, I think.
Oh, Patty, thank you so much. That was so helpful. And I wrote down a lot of takeaways just for myself, and I'm looking forward to more sessions in the future. Hopefully we can get some interaction and go over some more of those techniques. And we really appreciate you. Thank you. I want to switch gears now and move on to questions if we can. In order to give you guys a few more minutes to write in your questions or comments, I'm going to go over a few pieces of information and coming events that we have going on at the Resource Center. If you'd like to obtain any more information or resources, please reach out to the Resource Center. We're happy to field your calls or your walk-ins, emails, anything like that. Please reach out. We love hearing from you. And I wanted to take a moment to touch on both of Patty's support groups here. She does have two that happen recurrently. So if you'd like to register or learn more about them, feel free to call Patty or the Resource Center. And I do want to note that if either of those support groups don't seem to fit with what you're looking for, please let us know. We do have several other support groups that aren't listed here, so hopefully we can find something that fits for you, or perhaps a peer-to-peer, one-on-one sort of situation. So please do reach out to us if you have any questions or want to learn more about those sorts of resources. And we also have a newsletter if you'd like to be part of that, where we send out monthly updates. Next on our schedule is decoding your mammogram next week on Wednesday. If you're interested in registering for that, keep an eye out in your email if you're part of the newsletter list. And if not, just send us an email or give us a call. All right, now let's transition back to our questions. One of our attendees asked about a little bit more information about progressive relaxation. If you could maybe touch a little bit further on that, Patty, and we'd be happy to provide additional information via email if we don't answer all of these questions too.
Yeah, and that's also something, if you're computer savvy, you could YouTube it, right? And they will walk you through it. It is helpful to have an audio or a facilitator like the social workers do, or in our support groups, we walk you through a progressive muscle relaxation script. So generally it starts with a tightening and relaxing of different areas of your body, and you touch on your entire body while you're doing breathing. And it can be wonderful if you've held a lot of tension in your body and you may not even know the level of tension. So you go through it and you check in with your body periodically and you further relax those areas. Maybe you additionally tighten, not tighten to the sense of hurting, but tighten enough to feel it tighten, and then release it with your breath to notice the difference. So it's really teaching your brain to notice the difference between relaxation and tightness. And sometimes when we're so busy navigating life or illness or whatever it is, or pain, we don't realize how tight we've become. And pain really can be worsened by a tightened body. It's natural, instinctual to tighten when we're hurting, like we want to turtle up and tighten, but we can actually reduce pain by kind of leaning into that area of pain, giving it some breath and relaxing the rest of the body. It seems counterintuitive, but it does help. It really does. And I have a script, my favorite script I like to use, that is public and available to share, that I could email if someone emails Annie or sends their email onto this chat, however that magically works for Annie, or to the Cancer Resource Center, or call my number that's listed and give me your email, and I'm happy to share all the resources, or pop into one of our support groups, whatever you need, or check out YouTube if you're a YouTuber.
Yeah, YouTube is a great place to find different things and go down the rabbit hole. We have one other question. How much difficulty is there for social workers to meet the needs, I believe, of patients? And does it take a while to get help?
The answer to that is it depends. Probably true for everything. So it depends on how you're asking for help and what level of help you're needing, right? So we do have a lot of patients that come through the Cancer Center, as you can imagine. The 4 social workers on the team are very responsive. So you need to let us know, like, I'm calling because of blah, 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 and I need immediate help, or I'm just, when you have time, reach out, like that kind of gauges, or that distress scale. If you're a patient, the higher level of distress, the faster the response will be, honestly. And then, email and phone message reaches us directly. We all have our own direct phone lines that we pick up and respond to. So it's usually pretty quick. If you're already working with one of the social workers on the team, you will get a response from that social worker. So like, say my workmate her name's Heidi Garza. She's an amazing social worker. And I look at the chart and I see that she's already working with someone, I'm not going to call them, right? They have Heidi, she's amazing. She can offer all the same things I offer. So I know she's getting support. But it could be that you have to call. Maybe you said during an appointment, oh, I could really use someone to talk to, but maybe whoever you said it to didn't send anything to us, right? So we don't know. So call us, call that direct social work number. Every new patient gets one in their packet. The Cancer Resource Center has that information. You could go to any front desk at Radiation Oncology or the Cancer Center and say, I really want to talk to a social worker. That happens. And I will call people and we're available, and it doesn't cost any money. It's free of charge. It can be a one-off, one-time support, or it can be a continuation of support as needed. I hope that answered that.
Do you have a book you recommend for tapping?
I don't have a book per se. You know, there is if you go online, there's free PDF copies of oh gosh, I just blanked on the name of it. If you do EFT tapping online, Tapping Solutions, there it is. Oof. Tapping Solutions online, they probably do have a book, but there's a PDF for free that they let people print and use. But just know that I am not a Tapping Solutions provider. I do tapping as part of, I'm DBT trained and mindfulness trained, and tapping is part of that. I like their sequence. So I use their sequence, but I modify the rest. So you would have to look at it and see what part works for you and what part you would want to modify. But the sequencing is really wonderful how they set it up. And they have a visual for you too. So if someone doesn't have access to that but can email, I can send it, or call and give me a mailing address. I can send it to you because it's public and they let it, it's free to reproduce. And I can send it to you. But it is a wonderful sequencing, and it literally has a visual on your body where you're doing it, which is great. I love visuals. But the rest of it that they do with it, I don't facilitate those parts, but you might enjoy that. People do.
Great, we will have to check that out. I'm checking the chat and the questions, just making sure we're not missing anybody. If anyone has questions afterward, please feel free to call us. If you have a question you'd prefer to be answered privately, please call us or email us, whatever way you prefer. We still welcome walk-ins into the Resource Center as well. Like Patty mentioned, any front desk will be able to connect you. So please don't hesitate to reach out. We're happy to help. And with that, I will let everyone else get back to their days. Thank you all for participating. We really appreciate it. And thanks so much to you, Patty, for being our speaker. That was so informational.
Bye, y'all.